Hello everybody, this is Hassan Nafid, the Anatomy and Physiology instructor at Madison College in Wisconsin. Tonight we're going to talk about the skeletal system. The skeletal system performs a lot of important functions to our body. The skeletal system is the main site where calcium and other important minerals are stored. The skeletal system also is a site for erythropoiesis or red blood cells and white blood cells and platelets manufacturing. The skeletal system is a foundation upon which our systems are built, muscles are attached. It protects internal organs. It protects our internal viscera. The skeletal system also helps us to move and navigate the environment. I want to give you an idea about the organization and the anatomy of the skeletal system. I'm going to use one of the skeletons here to show you the classification of the skeletal system. The skeletal system is formed of two major categories: the axial skeleton and the appendicular skeleton. The axial skeleton basically is formed of the skull, the vertebral column, and the coccyx, while the appendicular skeleton is formed of the upper limbs, the lower limbs, and the pelvic bones. The skull is known as the cranium. It's formed of 8 bones that are put together by immovable joints. It's got 8 bones: frontal bones, parietal, temporal, occipital, and the facial bones. Take a look at the cranium or the skull. It's formed of 8 bones. This is the frontal bone, the parietal, temporal bone, and the occipital bone in the back. The facial bones are the bones that form the face. This is the zygomatic bone, the nasal bone, the maxillary, the mandible, and the bone that forms the orbits. Also, there is some bone that are seen in the nasal cavity, and these are best seen when the skull is open and we're looking at the interior of the skull. Going down, you're going to find the thoracic cavity. These are the sternum, the ribs, and partially the clavicle. The first rib is behind the clavicle, so it's not seen. There is 12 ribs in total. The first 7 are true ribs. 8 and 9 and 10 are false ribs because, as you see here, they're joined by one segment. I'm going to make it a little magnified for you. If you take a look at it here, look at the 8, 9, and 10 are joined by one intercostal cartilage, while the first ribs are from 1 to 7. These are bound or connected to the sternum by true cartilage. That's why they are called the true ribs. The last ribs, which are the false ribs, you find them in the bottom here, and these are the float-in ribs. On the posterior side, the vertebral column is formed of vertebrae. There's 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral, and 3 coccygeal vertebrae. Each one of these vertebrae, if you look at it, does have a body. It does have 2 processes. These are known as the transverse processes, and the spinous processes. This is the intravertebral foramina, and there is superior and inferior articular surfaces of each vertebra. The axial skeleton, as we said, is the skull, the vertebral column, and the coccyx. The appendicular skeleton at the side is formed from the upper and lower limbs, and these are the bones of the humerus, the ulna and the radius, and the hands bones, beside also the pelvic bones and the bones of the lower limbs. Bones of the lower limbs include the tibia, got one of the long bones, got a proximal end and a distal end. and also the largest bone in the body, which is the femur. The femur is the largest bone. As you see, it does have two ends, proximal and distal, epiphysis and a diaphysis, which is a shaft. It is a strong bone. It does have a lot of features. This is the head of the femur. These are the greater and lesser trochanter, and here is the condyles and epicondyle beside the fossa, and this is the articular surface for the patella. Pelvic bones are two, which are symmetrical, each one side: ischium, ilium, and the pubic bone. If you see them here, pubic bone, ischium, and ilium. Does have feature, is considered flat bone in some part of it. It does have the articular surface with the head of the femur. This is known as the acetabulum, and this is the inner side, which articulate with the sacrum of the axial skeleton. So to summarize, as we just talked about, we said the skeletal system is formed of two categories: axial skeleton and appendicular skeleton. Axial skeleton is the cranial bones or the skull and the facial bones, the vertebral column, the sacrum, while the appendicular skeleton or the upper limbs, you got the foramen arm, which is the humerus, ulnar radius, and the bones of the lower limbs, which are the femur, the tibia, the fibula, and the foot bones. Thank you for watching me, and I'll talk to you another time in one of our classes. Thank you.